hazardous disease and dengue fever are two of the world's most dreadful conditions. Just mentioning the name causes many people to become nervous and take precautions. Before the Covid-19 epidemic, the country was threatened by the dengue epidemic, which is also easily spread and still present and also contagious. Even though dengue cases are expected to be reduced by 75% by the year of 2021, the chairman of Asia Dengue Wise and Action Group believes that the person should remain vigilant about the risk of co-infection. COVID-19 is as well, which we have yet to be addressed fully. Dengue and COVID-19, on the other hand, can both cause severe illness and death. Clinical management for people who develop severe disease from either of these two is quite different, frequently necessitating hospitalization. We can distinguish between these two hazardous diseases in various ways, including transmission, incubation period, symptoms, the illness that will affect our body, and those at risk of suffering or contracting the illness. So let's dig deeper into the differences between COVID-19 and dengue.
Firstly, let's see how COVID-19 is transmitted from one person to another. COVID-19 is produced due to an infection with the SARS-CoV-2 virus, which has been shown to easily cause respiratory illness, pneumonia, and even lung swelling. COVID-19 is easily spread and transmitted to others via respiratory droplets, which is more likely when the infected person coughs, sneezes, or even speaks. As a result, people are now advised to wear face masks. On the day an individual shows symptoms, he has already been exposed to this median 4 to 5 days prior, and this exposure can last up to 14 days in the incubation period. Anyone with these symptoms is quarantined for 14 days after being declared symptomatic in our country. How do we know if someone has a severe illness in COVID-19? The probability of shortness of breath in most patients with severe disease can be studied as it is between 5 and 8 days. 8 to 12 days for respiratory disorders and 10 to 12 days for ICU admission. Dyspnea, hypoxia, respiratory failure, multi-organ system dysfunction, and shock are symptoms of severe illness.
Who is most vulnerable to this severe illness? In the case of COVID-19, the most susceptible individuals are those 65 and older, or to put it in another way, the elderly and veterans. As people age, most of them already have other primary diseases such as cardiovascular disease, diabetes, chronic respiratory disease, hypertension, previous stroke, liver disease, obesity, chronic lung disease, chronic kidney disease, and various others. Those who live in nursing homes are also high-risk factors because they are all in contact with many people from the outside world. Most people, as we know, will have early symptoms and signs before being confirmed positive for COVID-19. These symptoms can begin to range from mild to severe, and they can be dangerous in people who have other illnesses. Before you become infected with COVID-19, you may experience the following symptoms: fever or chills, persistent cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, the new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. An individual does not necessarily experience all of these symptoms, with only a few already indicating that you belong to the symptomatic group.
What about dengue fever? Dengue fever is distinct in these respects. Dengue fever has an incubation period of 3 until 10 days and 5 until 7 days. The bite of Aedes mosquitoes primarily transmits dengue. It carries a dangerous virus that causes illness in humans. We can say that unlike COVID-19, which requires interaction between individuals, this dengue is spread by the carrier animal itself. We can say that this dengue disease with any of the following symptoms and signs is considered severe dengue: fluid accumulation with respiratory distress, severe bleeding with thrombocytopenia, severe organ impairment such as liver disease with elevated transaminases, meningoencephalitis with impairment consciousness, or even heart impairment. Dengue fever can infect people of any age. Adolescents, children, and infants are among the risk factors for dengue, especially if infected for the second time. Patients with a chronic health problems such as diabetes or asthma also considered high risk.
Now, we also know that COVID-19 and dengue are two diseases that are difficult to differentiate because their symptoms vary. So, even if we know the distinction, how would a person determine whether the symptoms are COVID or dengue if in doubt? So we came up with the concept of creating an app app called C19D, which stands for COVID-19 and Dengue. This program, in our opinion, is for an individual to examine their health, mainly if they are unsure whether they are infected with COVID-19 or dengue. The routes of transmission of these two diseases are known to be distinct. Individuals can use this app to identify which disease their symptoms indicate. If the symptoms point to COVID-19, they can self-quarantine at home while waiting for an appointment at the COVID Assessment Center (CAC), owing to the disease. There is not yet a convincing prescription for us to continue consuming unless a physician prescribes it, or if dengue is suspected, the individual can begin to taking Panadol or paracetamol as a first step and precaution before the disease develops. Individuals must enter personal information into this application first to identify the residential area and ensure individual privacy. They will then be directed to a questionnaire about the symptoms they are experiencing. They must also rate the symptoms they are experiencing. Each piece of information provided and filled out will be compared to the app's average of our entered data. To expand the app's capabilities and marketability, we intend to include information about medicines and their functions and the most recent updates on Malaysian health issues so that users are more aware of their health. We will also need to collaborate with accredited and recognized medical agencies to ensure that our data is accurate and up to date for this app to be approved for use. To conclude, let's summarize all that we have discussed before. We can clearly see COVID-19 versus dengue in this table. Since these two diseases are extremely dangerous and can be fatal if not monitored and precautions are not taken, Malaysians must band together to combat the spread of these epidemics, particularly the COVID-19, which is still circulating around the world. To reduce the increase in this case in Malaysia, we all must lead a healthy lifestyle, maintain a clean environment, and follow all SOPs established by the Ministry of Health Malaysia.